Hello and welcome to the COVID-19 update for the town of Kingston. This is being recorded on January 12th. I am Donna Rodriguez, your host from PACTV, and I am being joined today by Kieran Kelleher, the health agent for the town of Kingston, as well as Beck, who is the nurse leader for Silver Lake Regional School District. Thank you both for being here with us today. We'd like to just jump right in and start to talk about some of the things that are happening in the town and for the school district. As we know, so much has been taking place since our last update in December, and especially this week, there have been so many updates on a day-to-day basis that we thought it's important that we start to get additional information out to our residents. So, Kieran, I'd love to start with you. Can you just give us a little update on what's been happening recently with trends and statistics for the town of Kingston related to COVID?
Yeah, absolutely. So some updated numbers here. Back in December 13th, we were at 149 cases. We're right around January 13th now, and we're up to 562 cases. So quite a significant increase. Obviously, a lot of that is due to holiday travel, spending time with family inside of homes. We were bound to see an uptick in numbers. But this variant, Omicron, has been highly transmissible. So I think probably maybe even more people than we expected are contracting it. So we've definitely seen a huge increase in numbers, since the holidays and since early December.
Let me ask you, Kieran, also, we're starting to hear that since so many folks are doing at-home testing, number one, those numbers can't be collected realistically. And number two, do you think that the numbers that you're getting are underreported as a result?
Yes, definitely underreported. Hopefully not by a significant amount. But yeah, we can't collect that information. And it's just not something our department right now is able to do. So yes, our numbers are skewed, but I wouldn't say it's huge. Maybe it's 20, 30 cases, but nothing that would really shift our perspective on anything.
So let me just stay with you for a second and ask, related to testing, what are the recommendations? When should people choose to test? And is there a preference between doing an at-home test or getting an appointment to go to get a test somewhere else?
Yeah, so the preference would be to go get a PCR test, much more reliable. It's not to say that doing an at-home test is bad. It's just sometimes it can lead to false positives, other things. So while it's a good, it provides you with that information that maybe you're positive, the best and most accurate is to go out and actually receive a PCR test. As far as some of the new guidelines, those were updated pretty recently. The main thing being that your quarantine is now for 5 days, not 10. So pretty much if you're positive, you stay out for 5 days and test again. But if you're symptomatic, you have to stay for that full 10 days or until you're not symptomatic. If you're a close contact, like say someone in your family gets it at home, again, if you're not symptomatic, with these new guidelines, you could continue to go to work or do your activities. I would recommend doing them masked, and then test on your day 5. And same thing applies. If you're still not symptomatic, you can go back into work as long as you test negative. So that's kind of the main new guidelines, is that 5-day mark. But again, if you're showing symptoms, it's still not recommended to go back to your daily activities. So,
and I wonder if you're hearing the same thing that I'm hearing anecdotally, that where it seems to get confusing is, where does day 1 start, correct? So day 0 is at when we start to show symptoms or when we test positive. So with the guidelines between if you are positive and asymptomatic, if you're positive and you have symptoms, if you've been exposed to a close contact. So is it the CDC website or mass.gov or both that you recommend people to go to for clear guidelines on that if they have questions?
Yeah, I would recommend going to both, but Mass.gov should have the up-to-date information for our communities. We don't stray really outside of state guidelines at the moment. So I would go to Mass.gov, but if you have further questions about it, definitely visit the CDC site. Everything you'd want to know is up there. So I would definitely recommend going to those two sites, yes.
Yeah, and mass.gov/COVID is updated Monday through Friday. There's a ton of information there, so people can get updates really quickly. And because there are so many things changing on a regular basis, I think it helps to have a resource that you know is reliable.
100%, yeah. And we try to update things on our Facebook page, our website as well. So that's just another resource if people want to take advantage of that. But yes, definitely the mass.gov/COVID website is the place to be for up-to-date information.
Excellent, thank you. I'd like to go to Carol now. Carol, you're all a week back from a holiday break in the school departments, and also, following a snow day last Friday. There's been a lot happening clearly in the schools. Can you give us just a brief update on the changes that happened before the holidays and after the holidays when it comes to basically numbers within the school department?
Sure. Thanks for having me on and allowing me to share what's going on within the schools, which tends to very much mimic the communities that we live in. Clearly, we all knew that there was going to be a spike after our holiday season, which is exactly what we've seen. Just to give you an example, and I know numbers can kind of get daunting and they change so quickly, but as of this morning when I looked at our numbers, we were seeing from January to December how much our numbers actually went up. To give you an example, between September and December, we had 162 cases in the district. That's within all 6 schools. And then between December 23rd and January 7th, we had 243, which puts our total from September to 405. So the spike that we had was between the 23rd and the 7th. So it showed significantly what we had sort of expected would happen after the holidays.
That is a huge jump, but it really goes in line with what's happening in the community as well, correct?
Correct, yeah.
Now, are you finding that these numbers are impacting education at this point? I know the school department has been so careful and bending and flexing every step of the way to ensure that you're providing safe education opportunities for our children. What have been the challenges you've been facing?
Well, I think the challenges are just trying to maintain the healthy environment that we have and using all of our mitigation processes, which we feel that we've been doing very successfully here in the schools. Schools are safe. The kids are here. They're happy. We hear them in the hallways, sounding just like kids, and it's a great place to be right now. The students have Test and Stay, which is our program that we have within the district to allow kids who have been close contacts within the school community to test for a period of 5 days. And as they remain negative, they're able to stay in the school instead of being sent home. There's some exemptions to the program, and that information is on our website. All of this information, because it changes so quickly and it's so hard for all of us to keep up with, if you go to our website here in the district, slrsd.org, you'll find all of this information there. And also the nurses put out a weekly Parent Square, which is a community communication that has all of the recent updates and all of the newest information. And with that said, with everything changing so rapidly, it gets so confusing for all of us that the best the best way to get your information if you become part of a situation is to call your school nurse specific to your child, your student, and the scenario that you're going through with them and your family. And they will have the up-to-date information to give to you and help you out with that. You can always reach me, and you can always, we suggest call your healthcare provider because your student and your family may have extenuating circumstances that make your situation a little bit different.
Now, I'm a parent of children in a different school system, but I've found that everybody has been so responsive and answer so many questions. So thank you all for what you're doing to support all of us in getting through this. It really is a team. And to go back to a couple of your points, our children in many instances seem to be so much more resilient than we are as adults. So I definitely enjoy seeing our kids being able to follow the guidelines and be back in school and feel safe and be able to have those social connections. And so it's wonderful to hear you saying how enjoyable it is to hear them laughing in the hallways too. So so we're hearing that things are working and that everybody is working to keep everybody safe. Now, one of the things that has changed in this school year already are guidelines and availability for vaccines and boosters for children who are school age. Can you tell us a little bit about, talk a little bit about the vaccines and boosters for ages 5 and up, what the school recommendations are, and if you have any information, how parents can get more info about getting their kids vaccinated?
Sure. We work collaboratively with the Board of Health, and there are vaccine clinics that we're having at our Kingston Intermediate School that Leanne McGinnis, the Board of Health nurse, has been overseeing. And I know they also have clinics through the town at the town hall. All of those dates and information, again, can be seen on the town website. Mm-hmm. And they are also on the district website here. And again, if anybody has any questions, they can for their own children, they can certainly call any one of the school nurses who would give them the links in order to sign up for appointments. I believe the town. Mm-hmm.
Is it helpful for parents to report into their school if their children have been vaccinated or boosted?
I think any information that we can get will certainly help us with our numbers. Our numbers are lagged. There's so much going on within the state as far as reporting and getting those numbers back quickly, that I know our numbers look fairly low right now. But I know just by the clinic activity and by parent conversation that there's certainly a lot more kids that have been vaccinated that are showing up statistically, which is great.
Right,
I think the middle school and the high school obviously have the highest numbers. They're about 60% and 70% respectively, and then the intermediate school has a low percent of like 1%, but again, we know the numbers are higher than what we're actually getting reports for.
And it's been fairly recent that ages 5 and up have been eligible for vaccines as well. So I'm sure the information will be coming to you. And speaking about vaccinations and vaccination clinics, Kieran, I'd like to come back to you. Kingston has done a phenomenal job of being able to offer community clinics both at the schools and at the townhouse. Would you like to speak to some of the ones that are coming up in January? And I know you're going to be continuing to schedule them as we move forward.
Yeah, so a huge credit to Leanne McGinnis, who's our public health nurse. She has just been amazing flying around town doing these clinics. So our closest ones are January 14th. That'll be 9 to 11 a.m. and that is at Kingston Town Hall. That's Pfizer or Moderna. A week from that, January 21st, same time, 9 to 11, Pfizer and Moderna, Kingston Townhouse. And then Saturday, the 22nd of January, from 9 to 1 p.m. at Kingston Intermediate School, there'll also be a clinic with Pfizer, and that'll be mainly for children, I believe. Make an appointment, preferably for children 5 to 11, but walk-ins are accepted. All of that information can be found on the health's website, as well as our Facebook page. So definitely go on there, and I obviously recommend, if you're not vaccinated or boosted, definitely attend those. I think it's one of our biggest weapons against this virus is getting boosted, getting vaccinated. And we're just happy that we can put on these clinics for the community. And another brief thing I want to say is, amidst all of this kind of dreary and dismal, inflammation of COVID, there will be a time when we're not dealing with it like this. And I just want to remind people that it may not go away completely. We may have to live with this for the indefinite future, but there will be a time where it is not going to consume our everyday lives. So it's tough to look forward to those moments, but I just want to put that out there, that this isn't forever. So,
and we're already starting to see reports that the estimate is by the end of this month, we're going to hit the peak in Massachusetts and hopefully start to come down. So if we are doing everything we can to mitigate and to keep ourselves and our community safe, hopefully we're going to get to that point sooner rather than later.
Hopefully.
Now, the town of Kingston, again, your vaccination clinics have been incredibly popular and well visited. People can go to the town website to get information about the specific clinics, because there are some differences with age limits and who needs to make an appointment and who can just do a walk-in. But also, I think on mass.gov, people can sign up there under the Vax Finder section of the website and be able to choose one of the Kingston vaccination clinics as well, correct?
That's correct. Yep. Vax Finder is a great resource. You can basically just pump in your zip code, and it should pop up with those different vaccination sites, and all of that information relative to age and what you need to bring should be on there, as well as, like you said, the town's website and the health department's specific page. So,
excellent, thank you. And speaking to one of the things you mentioned just a moment ago, some of the guidelines and things that we're all following. Kingston has had an update in one of their town mandates through the Board of Health recently, just last week. Can you talk a little bit about, there is a new mandate for masking in certain areas in the town. Could you speak to that, please?
Yep, so there is a mask mandate that was put into place. It is for all town-owned buildings, and that is for employees working there and anyone coming in doing business. They are asked to mask up regardless of vaccination status. So it's not for the entirety of Kingston. It's not for businesses. It's just for town-owned buildings.
And that's ages 2 and up. It's separate from school buildings. It's town-owned buildings, and it is in place until the Board of Health removes it. Correct?
That's correct. Yes.
Okay. And there was also a recent update, just I believe Monday or Tuesday, with DESE, which is the Department of Elementary and Secondary Education. Carol, would you like to speak to that update for mask mandates within the schools?
So yes, mask mandates have been extended from their original January date, and I believe that we'll be seeing, as soon as we start seeing our cases lift a little bit, they'll revisit that mandate for the schools. The DESE close contact and positive testing, again, as Kieran just mentioned a little while ago, was changed. Their protocol has changed to the 5-day protocol from the previous protocols. Although all of their symptomatic situations for testing have stayed the same, and all of their criteria for symptoms have pretty much stayed the same. Again, we urge people to reach out and ask questions, and every scenario, every family situation is different, and we can certainly help everybody apply the new protocols to whatever situation they're in.
So I have two more questions to you, Carol. Number one, are you finding, just anecdotally in what you're hearing from the schools in Silver Lake, that there are any different presentations with symptoms in the pediatric group versus adults?
I think we're not. I think we're seeing symptomatically. I think the presentations are fairly similar in the sense of people who are showing initial symptoms. The symptoms of fever, cough, sore throat, headache are pretty much what we're seeing. And then again, there is some students and staff that are asymptomatic or showing no symptoms at all. So it does really vary from person to person, and I don't think that we're seeing specifically by age. I think it's just person to person. And again, that's why we ask people to reach out to their physicians, because people have underlying symptoms, and their treatments and their situations will be different.
And believe it or not, we only have a couple of minutes left. Are there any, I'm sure with the questions you get from families every day, there are a couple of things that are fairly common. What are some of the most frequently asked questions you're receiving right now from families?
Within the schools, you mean? Families are just really confused with the guidelines. They're very confused with the different protocols, and some are right on top of the changes, and some say, oh, that's not what I thought we were supposed to be doing. So I think there's a lot of education, and I think as you had said before, there's COVID fatigue. People just want the sun to shine brighter, which, as Kieran said, definitely the sun will shine brighter again. And I think we just need to help people get through this period that we're in right now. And then as things start to look better, then I think people will feel better about everything.
And for more information, particularly to the schools, people can go to slrsd.org, Silver Lake Regional School District.org, to find the phone number for their school, to be able to talk to their local nursing staff, or also just to get general guidelines that are coming out from the school department, correct?
Correct. We have a pandemic resource center right on the district page, and they can start there, and they can, again, like you said, access their building nurse for their student. And right now they're the best resource, and more than happy to reach out to anyone who has any questions or concerns.
Perfect. Thank you so much. And Kieran, I'd like to come back to you as well before we close out. Just ask from what you're hearing in your department and from Town Hall, some of the most frequently asked questions, or some of your final comments and things you'd like to offer to the community.
Yeah, similar to what Carol was talking about, definitely the new guidelines, isolation and quarantine, are very popular questions. Those, again, if you go to mass.gov, all of those in detail isolation and quarantine protocols are on there. So I highly recommend visiting the mass.gov COVID page. Testing has been a big one, at-home testing kits. The town of Kingston is not receiving any of those for free, so we'd have to purchase those. It's something we'll look into. I don't know, what exactly will be done there, but you can still get them, although they're in limited quantity in CVS's and Walgreens, etc. As far as closing thoughts, I just want to thank Carol for being on, and Donna, you for having me. And hopefully this does get better, but I just want to say that the health department is here for the community. And if you guys have any questions or concerns, feel free to call in or email us. So.
Thank you both for being a part of the show today. A couple of additional resources we just want to offer very quickly are Kieran, you were talking about at-home testing, and we understand that through the federal government, people are going to be able to purchase at-home tests when they can access them. That also will, starting on January 15th, be reimbursable or paid through their health insurance. So please keep an eye on the mass.gov/COVID website to get updated information there. And another thing that just came out this week is for folks who have been vaccinated, there is a new way to be able to track your vaccinations and be able to save it on your device or be able to share it through myvaxrecords.mass.gov. So there is a lot more that's coming out for all of us to be able to, find information more easily, to be able to keep up with these constant changes that are happening. And just to go back to the two of you, I'd like to again thank both of you for all that you and the community at the school and at the townhouse are doing to be able to support residents and to be able to get information out there, to be able to keep people healthy and safe, and for joining us today. So thank you for being here as part of this show.
Thank you, Donna. Thank you.
And for those of you who are watching, if you've missed part of this, we'd love to have you be able to take a look at it in full. Please visit pac-tv.org/watch to find out how you can watch replays. Thank you again for joining us today.